Preeclampsia is a medical condition that typically develops after 20 weeks. It can lead to high blood pressure and other medical complications that can affect me and my baby. I've been doing a lot of reading and all of this is really confusing, so I am taking you with me to my doctor's appointment so we can all get a little more clarity. Come on, let's go. I'm driving. Hi, Dr. Hamersley. I have so many questions for you. I am very excited to be here. But can you tell me a little bit about your work and what kind of a doctor you are?
I am a pregnancy specialist. So I deal with pregnancy complications where either the mother, the baby, or both have a problem.
So I just want to pick your brain a little bit about preeclampsia. I'm 10 weeks along and I'm a little worried about preeclampsia. Can you just tell me a little bit about what it is, or a lot about what it is?
Preeclampsia is a condition, it's a pregnancy-related disease where the mother's blood pressure goes up, and it's usually defined as a pressure that's higher than 140/90. Sometimes the women develop protein in the urine, severe headaches, swelling to the point where they gain over 5 pounds in 1 week.
What kind of person is at risk for developing preeclampsia?
Anyone in which this is a first-time pregnancy.
Okay.
Is this your first pregnancy?
Yeah.
So that could put you at risk, but we're going to talk about it, so I don't want you to worry about that. If you have a first-degree relative who also had preeclampsia, like your mother, your aunt, a sister.
Okay.
If you have underlying high blood pressure, sometimes if you're carrying more than one baby, twins, triplets, can also increase the risk for preeclampsia.
So is there anything else that I should know about preeclampsia?
Yes, so we have 2 patients typically, the pregnant mother and the unborn baby. Obviously, if the baby is delivered early, there are potentially long-term complications related to prematurity for that baby. But for the mother, she can have up to a 50% risk for developing cardiovascular disease when she's age 50.
Wow, that's heady stuff. Good to know.
Yeah.
So is there any way of finding out ahead of time if I'm at risk of developing it, or do I just have to super hope I don't?
No, you can put your mind at ease by knowing there is a test that can detect whether or not you are at risk for preeclampsia, and it can be done the 3rd month of pregnancy.
Okay, great. I'm 10 weeks, so pretty soon I'll be able to start keeping a lookout for that. That's awesome. So if I do test positive, what happens next?
First of all, do not panic. We got this one. So we monitor your blood pressure, we monitor the urine for protein, and then we give you 2 aspirins. So you know that old joke? The doctor says, take 2 aspirin and call me in the morning?
Oh yeah, classic punchline.
That's what we do.
That's amazing.
The test itself will take about a week to come back. In that time, we are processing the blood that we have drawn. When that risk calculation comes back in a week, it will tell us if you are at risk.
Thank you, doctor.
You're so welcome.
See? I feel so much better. Now, instead of waiting to see if I develop preeclampsia, I can get pre-screened. Oh, I love knowing all my options. Now, this frees me up to research other questions like, why am I growing a beard on my stomach?